Good morning. This is a heat map we've been looking at for the past several months, and we saw the high transmission counties was in the 94-ish range for a long time, and then it kind of hovered in the 70% range. And now the high transmission counties is down to 65%. We're seeing a lot more substantial, moderate, and low counties. You can see the southeast is really where a lot of the drop in the cases are occurring. We're also seeing a little bit on the west coast as well. However, overall in the United States, cases have gone up. They've gone up 16% in the last 7 days. So where cases are going down, they're going down, but they're going up in places that were even historically highly vaccinated, and like Vermont and the Northeast. I haven't looked at forecasts to see where it's going to go, but looks like the trajectory for Washington State that they suspect it'll continue to go down through January. Hospitalizations across the country are up slightly, and that coincides with the increased case rate, but deaths are down a little bit nationwide. In Washington State, we continue to see a decline in our case rate curve. Looking at the heat map for Washington State, we're seeing a lot more moderate and substantial counties. Walla Walla County is now in the moderate range. And as a state, the CDC now classifies us as a substantial transmission state. And we saw that in California a couple of weeks ago, that they, as a state, were classified as such. So that's good news for the Pacific Northwest. Washington State hospitalizations have continued to go down, and deaths across the state ticked up slightly, but the overall trend is still on the downward trend. In Walla Walla, just like we've had a slow, steady rise in our case rate curve, we seem to have somewhat of a slow, steady decline. Our case rate curve is just slightly above the state average. This little gray dotted line here is the incomplete data, but it's definitely trending downward. And likewise, our hospitalizations have decreased. Looking at our vaccination efforts, Walla Walla County ranks 12th with initiating vaccines per total population. And we even surpassed some of the west side counties that have a lot more resources. So I'm proud of that. There's been a lot of questions about the Omicron variant, and you have heard it on the news. We have not seen any cases in the U.S. as of yet, but there have been cases diagnosed in Canada, and so we're pretty sure Omicron variant is here. Our state is one of the most vigorous with sequencing, and so it's highly likely that because of our sequencing program in Washington State through DOH and University of Washington lab, that we likely will be one of the first to detect that variant. There are a lot of questions about the transmissibility. Supposedly it's much more transmissible, but as far as the severity of illness, it seems to be less. But there are also questions about reinfection risk and breakthrough cases. So it's too early to tell, but if it is a variant that is highly transmissible but causes mild disease, that could be of benefit in getting more natural immunity. But again, it's just too early to tell. And the mitigation measures for Washington State still remain the same. We still have the Delta variant here. That's our major variant. So continuing the efforts of getting people vaccinated, and also getting people to get boosters. And basically, I know the guidelines can be confusing, but basically anybody 18 and over, and I think the CDC just changed the wording, but yesterday or the day before, but anyone 18 and over should get a booster. So we recommend that people do so. And then also the masking and the distancing. We also we'll start this program today, and we're able to patch it together and we go live today, but this program is Say Yes to COVID Test. Here's the link right here. We'll have this posted on our social media and our website, but basically it allows individuals to order tests direct, and it'll be sent directly to their home from Amazon. So keep an eye out for our information on this, and tell people it's just another way to get tested.